I call them now the architects of health in female bodies. So they are sitting at the center of a really complex signaling network. It's important that we don't cartoonize it or make it sound trivial because it's complicated, and I want to make it clear that we by no means understand how it's like what it's doing or how it's doing it. What we do know is what happens when ovaries aren't working properly or when we take them away. That's how we know what they're doing. And I think it's fair to say that even in girls as young as 10 and younger, ovaries are important for maintaining health. So in young girls, if ovaries aren't working properly, that might lead to issues going through puberty or could lead to things like irregular menstrual cycling. In women in their 20s, ovaries not working properly could uncover risk for things like polycystic ovarian syndrome, PCOS, or POI, primary ovarian insufficiency, or even POF, which is primary ovarian failure, which is when ovaries stop working and for reasons we don't fully understand in young women, and they go through menopause kind of overnight. It's very dramatic. And the medical community treats that like it's an emergency and sort of, throws everything they can at it. But when that happens, exactly the same process happens a few decades later. We just tell women to suck it up. So there's a strange cognitive dissonance there that I think we should consider. Obviously, when ovaries aren't working properly in a woman's 30s, that can uncover risk for infertility and things like miscarriage, which we're much more familiar with. When ovarian function starts to fluctuate in a woman's 40s, that really is why we have so many different symptoms associated with menopause, because in perimenopause, there are, we know a few of the words in the chemical conversation that ovaries are having with other tissues, right? We know a little bit about the hormonal symphony that's required to maintain menstruation and to promote regular cycling. That's important for fertility. But if the level at which we understand that, imagine that there's dozens of other hormones that are being produced by or sensed by ovaries that are important for all kinds of different things. And we don't know yet what they are or how they're working, but they're there. And so, when we think about ovarian function and health, I think we still have a lot to learn. And of course, at and after menopause, when ovaries stop working the way they were before, I don't say that they've failed, because I think that that's a mistake. We know that ovaries do something after menopause, we just don't know what. It's certainly very different from what they were doing before.